Assalamu alaikum. Good morning, good afternoon, good evening, everyone. Thank you for joining us today for an amazing webinar. Professor Nirmala Rege will be our speaker. Just a little background about Professor Rege. She's an eminent pharmacologist, researcher, and medical educator with decades of experience in academia and clinical research. She's a professor of pharmacology at ERA's Lucknow Medical College and Hospital and professor emeritus at Seth GS Medical College and KEM Hospital in Mumbai. A former fellow and a former president of the Academy of Health Professions Educators, Professor Rege has authored several renowned textbooks, led numerous nationally funded research projects, received over 40 research awards, and published more than 160 scholarly articles. Her contribution to pharmacology, medical education, and health professions training have had a lasting impact on healthcare education across India and beyond. Thank you, Professor Rege, for joining us today and sharing your knowledge and experience with all of us. The floor is yours, please.
Thank you, Sakina. Let me share. I can't see my slides.
We can see it.
You can, but
yeah, you can stop and start sharing again.
Okay, I will stop sharing. So thank you very much, Sakina.
Mhm.
Actually, when I means I'm not an expert in scoping reviews, conducting it or writing one. I've written only one scoping review, and which was got published in December 2025 in Journal of Postgraduate Medicine. And you may be wondering why I'm here then. But I thought that whatever the learning occurred during that period and whatever the experiences I got, I will like to share with you. So some of you who have never done scoping review, you may get benefited, and you will not commit the mistakes as we have committed. We went a lot of back and forth while doing it, so you will not do it. And second thing, for selfish reason also, because there are people like Dr. Zaidi, Dr. Wajid I have seen, and Sucheta and all, so that you can give more, tell me that where we went wrong, or what additional things have to be done. So your experiences will be also there. Uh, Unfortunately, I'm not making it as interactive at every set, but you can stop me at any time and ask me question when you want. The topic I'm taking, as I mentioned, is scoping review, its purpose, process, and publishing. And at the end of this particular webinar, I feel that the participants shall be able to explain the purpose and scope, as I mentioned, differentiate the scoping reviews from systematic reviews, describe the key steps to be taken. Then there are tools and reporting guidelines are available which are relevant for scoping reviews. So they can, you appreciate those, and I will share, as I mentioned, some tips for writing and publishing the scoping review manuscript. All of us are in that evidence-based era, and those who have conducted some clinical trials, you must be knowing that after the first randomized control trial in early 1990, where there are multiple trials got conducted on one drug or other, people started thinking that we should know that, because in some trials the results were positive, some trials they were negative. That's to make that decision for patients. We should have some practice, and therefore we should weigh the evidence based on that, and That gave rise to the Cochrane reviews and systematic reviews and meta-analysis. And JBI evidence synthesis was also one of them. And as there is a increase in the primary research, the original research, also the research evidence started getting generated through multiple ways. And there were qualitative research methodology we started coming in, as well as mixed method research. Then there were evidences in form of research letters or even through the various conferences. So there are multiple ways, and ultimately a science emerged, and that science is a evidence synthesis science. So which is mainly, as I said, for the healthcare decision making. So that collecting these various evidences, evaluating them, and presenting that as a ultimate what is a true research evidence, or what happens with that particular therapy, intervention, diagnostic tool. All these things led to this particular science. But people use different methodologies also, depending on the different forms of evidence. The research questions were different, objectives, process, and depending on also the relevance and the rigor. And newer approaches started coming it, or modification of the existing method technique. So there are variety of review types are now we started seeing in the literature. And Grant and Booth, they compiled all those in 2009. And I will not go into this table, but you can see that different critical review, literature review, mapping review, meta-analysis, mixed method, overview. There are 14 such umbrella reviews. So 14 such review types came. By 2016, they increased to 25, and by 2019, this evidence synthesis or knowledge synthesis increased to 48 types. And scoping review is one of them. And it is called earlier as a mapping review, scoping studies, scoping exercises. In 2015 to 17, it was also labeled as a systematic scoping review. But ultimately, now everyone is settled that it should be called as a scoping review. The definition came as early as 2001, and if you look at it, it mentions that the aim is to map rapidly the key concepts underpinning a research area, and the main sources and types of evidence available. And it can be undertaken as a standalone project in their own right, especially, and this is very important, when area is complex and has not been reviewed comprehensively before. Later on, for additional definitions started coming, it refining the earlier one. But now, which is one is accepted, is a scoping reviews are a type of evidence synthesis that aims to systematically identify and map the breadth of evidence available on any topic, field, concept, any issue, and often irrespective of sources. Means it will consider the primary research, reviews, non-empirical evidence within or across particular contexts. So the breadth of evidence is more important for the scoping review, but the depth of evidence goes on varying depending on the individual reviewer and the research question which has been asked and how they conduct the study. So it is always in the exploratory nature. It will address question, but the questions are very wide range. And I will show you some of the questions later on. And it has a broad scope because the inclusion criteria, what you will include in the review, the evidence sources, they are less restrictive. As I said, it is not just the primary studies, original research, but it could be anything, whatever is published, depending on, again, on the research question and that researcher. So it is an expansive inclusion criteria. They are based on the expansive inclusion criteria. They are useful for bringing together the evidence from disparate or heterogeneous sources. And again, I put it that when the area is complex, when it is less known, this type of review can give you whatever is the knowledge evidence available on that particular topic. So It is mainly to determine what kind of evidence is available, both quantitative as well as qualitative, and then represent this evidence by mapping or charting the data in a way that it is user friendly, that anyone can understand looking at charting of the data, that how the evidence is mapped. Uh, in 2005, Arske and O'Malley, they, developed the framework, methodological framework for scoping reviews, because by that time there was no guidance. So people were doing reviewing, and they are calling them as a scoping review based on that earlier definitions, whatever available. But these do, they mention what are the reasons for scoping reviews. And they have found out there are four reasons. One is to examine the extent, range, and nature of the research available for that particular topic, so that giving them the whatever is the scope and whether it is broader or not. Secondly, to summarize and disseminate whatever the research findings. So from the evidences, they will collate and they will put it the summary, that is to inform the researchers, that is to inform the policymakers or any stakeholder. Then to identify the research gap in the existing literature. So there may be some area where there may be some gaps, the knowledge gaps especially, because these, unlike the systematic review, we don't look at the quality of the research. So in case of scoping review, unless the research question demands it, and therefore actually whether the research study is biased or there is a gap can be identified. But one can identify where the areas are there is no research, or whether there is something which is lacking, and those things can be then worked out by the others. And definitely to determine the value of conducting a full systematic research. Because if you want to conduct the systematic research, then you should be very sure that you get the enough articles to include. Because in case of systematic research, you have to put the inclusion criteria, and which are very, very robust. So that feasibility, whether it is there or not, and whether to do it, whether it will be relevant, that also can be told. Later on, the JBI working group, and I will tell you later about this JBI. It is a Joanna Bates Institute from Australia, and they do the lot of work on evidence synthesis, and especially in the earlier period, most of the work was on the systematic review, and now they have developed the guidance for scoping review as well. So the review methodology group identified these six reasons, which have their roots in whatever has been mentioned by Arske and O'Malley. But they have said that it is identify the types of available evidence in a given field, and what type of evidence, whether it is qualitative, quantitative, other. How much diverse is the evidence, and to clarify the key concepts or definitions in the literature, because as I said, the definitions goes on changing, or some of the terms which are used in the literature, there may be some overlapping and there is no clarity. So to clarify that, to examine how research is conducted in certain topic or field. So that is what I said. Suppose there are any gaps, or what methodology has been used, what study designs have been used, what measurement instruments have been used, and to identify the key characteristics or factors related to the concept. The concept is the topic for which you are looking for the evidence. So related to that, what are the factors, and precursor to a systematic review, as I mentioned earlier, and to identify and analyze any knowledge gaps. If you look at again those diagrams, the quarters on the left-hand side, you will see that the blue color one, both the extent and the range and nature, as well as the determining value, they are that shows that the review process actually is in a continuum. As the more and more research evidence comes in, we want to have the evidence synthesis. So even in the Cochrane reviews, you must have seen, initially we have the review of a particular intervention has been done, but after few years, as more evidence gathers, again the systematic review can be performed. And these can both these indications show that it is a continuous process, mainly to undertake ultimately the systematic review. While on the pink ones on the right hand side, those two quarters indicate that the scoping review, it's a method of review in its own right, and it does the function of informing the others and finding out the knowledge gap. There was an article by Trico and in 2016 where 494 scoping reviews were studied to find out what are the common reasons for performing it. And you will see that almost 68% reviews, it is to explore the breadth and extent of evidence, as I said, mapping and summarizing needs to that. And there were very few for addressing knowledge gaps or implication to practice and policy, and very, very few to develop conceptual framework or to identify the key terms. Now, how this scoping review differs from the traditional or literature review? We, all of us in our lifetime, we have written or read the traditional literature review. So you know that there is no research question as such. The author may give mention why he's writing that review, why he's collating it, but there is no protocol prior to writing the review. So there is no question of registering it. This Prospero registration, the Prospero is a database where the systematic reviews, they get registered, which is a mandatory thing. So there is no registration as there is no protocol. The methodology of the search strategy is not explicit or transparent. We don't know what the person has searched, what the person has not taken into account. And the quality of the assessment the person may do or may not do, it is not mentioned. There is no standardized data form from extraction form which is required for the other two reviews, where the data from those evidences will be collected, and there is no critical appraisal of those evidences. Means if the person who writes the review, he may do it, he may not do it, and there is no synthesis as such and finding. So it is more or less as a subjective. It depends on the what is the experience of that writer and what is the expertise of that writer. As against this, systematic reviews are very, very there is a research question, and it is a very focused, narrow research question. So if you want to find out the effectiveness of the drug or any intervention for in health professions education, or feasibility of that intervention, whether it is appropriate or not, or as I mentioned earlier, for the diagnostic accuracy, or whether what is the prevalence or incidence in case of disease, or selection of the health measurement, any equipment you want to use, then those are possible, and for the through the systematic review. But for that, you have to ask the precise research question. And you all know that these questions are usually based on that mnemonics PICOT, that population, intervention, comparator, outcomes, and the type. Whereas in case of scoping review, research question is required, but it is usually very broad based. Means if you are asking the effectiveness of therapy for the systematic review, here you may ask just what type of evidence is existing, or what are the characteristics of that concept, or what type of research exists related to a particular TL method or the assessment method in the literature. So it is a very broad-based one. Protocol is necessary. In fact, the current guidelines or PRISMA SCR guidelines, they say that the protocol has to be done, but the registration of the protocol it's not taken in the Prospero side. And it is not mandatory so far. But in the open, if you see the asterisks below the table, open science for framework or fixed share, you can register the protocol, and more people are now going for the registration. The one has to have a very explicit, transparent, peer-reviewed strategy. And why that search strategy? Because the main purpose of the scoping review or the systematic review is that it should be reliable. If someone wants to search again, then all the steps should be available for the readers to reproduce the results. So it has to be very explicit, systematic, and exhaustive. Uh, Assessment of the quality included in the study. Usually, as I mentioned, the studies are with a very narrow focus. As the research questions are narrow and focused, the studies are also of the narrow range. And the quality has to be assessed for the systematic review. In case of scoping review, they are usually broad range, and the quality assessment is usually not done unless you specify it in the review question. So it is scoping reviews gives you an overview rather than going too much into the depth of the quality. And the data extraction form has to be there. It's a standardized data extraction form. And the critical appraisal of the articles which are included in the systematic review to find out the risk of bias, because the article may not be written, the methodology may be poor, and that will vitiate the results of the review. So the outcome, what you are seeking out from this review, the evidence may not be correct. So they have to judge the risk of bias and then excludes those reviews. Whereas in case of scoping review, sometimes it is done, and for some because the quality assessment only it's not done through the appraisal. So unless again in the research question, it will not be cut. And lastly, there is a synthesis of findings from the individual study, and you get the summary finding in case of systematic review. And that's why we go for the statistical test, that meta-analysis or meta-synthesis if it is a qualitative one. But in case of scoping review, it is not needed. This we will see further. It is mainly that you are describing it, whatever it's seen. So you are identifying certain characteristics, you are doing mapping, you are reporting whatever is happening in the field. And therefore, there is no descriptive statistics is there. There is no analysis. Now, if you look at this particular chart, that is the methodology of scoping review, how it is evolved, you will, as I mentioned earlier, it started in the early 2000. And in 2002, Eric et al. Mentioned about this the scoping reviews and the definition also. And then in 2005, as I mentioned, Arce and O'Malley, along with that four reasons, they prepared the original framework, how the scoping review should be conducted, and they described those stages, which were then advanced and extended by the Levac, Holban, and O'Brien in 2010. And then there is an article by Peter et al. In 2015 and 17 where the guidance was developed. And this was done in association with the working group of that Joanna Beek's Institute from Australia and the Joanna Beek Institute collaborators from. So it is many international expert got involved in that. And later on in 2018, the PRISMA guidelines that is which have been used for reporting the systematic reviews, they were extended, and it is a PRISMA extension for scoping review, so which is termed as PRISMA SCR. And this is not, it is a dynamic process. It kept on evaluating, and the JBI evidence synthesis has its own website. And if you go on the website, you will find the JBI manual, evidence manual. And there is updated versions. They occur in 2020, and now the last update was in 2024. So there is a change slowly, and many articles came up for guidance, like for how to write the protocol, how to do that search, or how to extract the data, how to analyze, how to report, etc. So now it is more or less established. Now, what are the key steps which are involved in this particular scoping while writing the scoping review? As I said, the protocol writing is a must. So, a priori protocol, which will include title, objectives, review question or question. When there could be one review question with subsequent sub questions or the objectives and the methods. And the once that protocol is written and it is registered or not registered, but with that particular protocol, one can then proceed further. And then final manuscript, you will write the results, discussion, whether you got the funding for this, whether there was any conflict of interest, acknowledgement, like our other uh, articles or the other review procedure. So I will go a little bit about the protocol and cover the first three things, and then we will see about the manuscript. So this protocol serves as a roadmap for the reviewers so that you will not miss anything. If it is written, it is a plan for what you want to achieve at the end. So if you have a well-written plan, then you will not deviate much, and there may not be any arbitrary or decision making or unintended duplication during the review. So that can cause bias and that can be avoided. Secondly, when it is written, it fosters the collaboration. People, it is not that the scoping review should be done only at one place, one institute. Geographically, anyone can come together and collaborate and do it. So if there is already the protocol in place and the roles and responsibilities of the team conducting it, like our clinical trial, we have a principal investigator and co-investigator, and everyone's role has been defined. So that there will not be repetition of the work. And it facilitates detection of the selective reporting. So what was there earlier and what happened at the end of this? Because if there is nothing, I may do some selective reporting. So that selective reporting, and I may leave some of the studies. That should not happen. I should, whenever I am writing the scoping review, I should see the total search results and screen it and get the detection, and there should not be anything hidden in the ultimate thing, and that can be detected if there is a prior protocol. uh, if it is published, then the researcher will have advantage because there will be you get some ideas from the research community. And while reporting, I will suggest that one can use the guideline to make your protocol robust. The guidelines are for reporting the scoping review, but if the guidelines are kept in front and if you see in the protocol those steps can be taken, then it is beneficial to the the people who are reviewing it. When we did our study, we developed the protocol after reading the guidance, but we didn't register it that time, and therefore we didn't get any any feedback from the anyone. Means there were four people involved in that project, and everyone was novice, and then we had to read and discuss with each other and do it. But later on, now we are doing a second scoping review. We decided we will register it, and we registered the protocol and we sent it for publication. And we received a lot of comments on that particular protocol. It has not yet got published. We have just written the answers to that. But we learned a lot through that, and our protocol got strengthened. And naturally, because of that, the review will get strengthened. And if someone wants to see how to do the this thing protocol, then there is a checklist for the protocol, and that is available at JBI site. I have mentioned about this manual. So there is a fillable checklist, so you can go on filling in that particular checklist to evolve your protocol. Now, all this title, review question, and the inclusion criteria. They should be in congruence with each other. And the foundation of this is by the PCC. I mentioned about the PICOT. So similarly, PCC is for the scoping review. The P stands for population or the participant. So what are the characteristics of the participants who are coming in the study? From whether they are students, whether they are faculty members, what will be the age group, the gender, and whatever special attributes, if you are doing the study in the slow learners, whatever is their characteristic attributes, that will come. Again, it depends on your question. The concept means the topic to be explored. So that concept can be interventions you are doing, or educational programs, educational module you are setting up. It could be outcomes also. If you are interested in students' performance or any phenomena of interest. And as I said earlier, while discussing the reasons, it may relate to the definition, the methodological approaches which have been used, the study design, all the theories. So all these things come under the concept. And the context is the geographical location. It could be India, it could be any other country or many countries together. Healthcare setting, primary, tertiary, community, or any specific social, cultural, sex-based factors. Now, in the title, it is necessary that you will be putting some of these, at least the points from the PCC, but the title should always mention that it is a scoping review. So that is mandatory. Secondly, the review questions also are based on this. And in inclusion criteria, you have to describe this, what you will like to include, based on whatever the population concept and context you are thinking about. When we did this particular study, I'm not saying our title and this thing is the ideal one. When I'm looking at it, I can appraise myself also. But we kept the title as Mapping the Landscape, a scoping review of how medical education research in India evolved post 2015. And our review question was, what are the trends in medical education research in India from 2016 to 2021 regarding research themes, institutional, departmental contribution, type of participants, methodologies, outcome, analysis, and overall quality. Now, can you tell me what is the context over here? Anyone? You can unmute and tell me. Any one of you?
Well, that could be, yeah. This is Ibrahim from Pakistan. So, ma'am, the context should be the medical education in India, basically. We can consider that could be, yeah,
Origin and
Indian Medical Research Committee.
And even the time duration. We are only
Time
selecting
duration.
between 2016 to 2021. Okay? And the concept will be this, the rest of the thing. That what we are trying to do is the trends in medical education research. And these trends we have defined, like themes, institutional contribution, type of participants, etc. analysis. So we have not specified the participants over here because that was the one which we wanted to extract from these articles. So writing the population is not always a must. If you are focusing on the research design, then there will not be any population. And one more thing we included over here is overall quality. And as I mentioned, that it is actually not necessary. We should have done away with this. There was no need to include the quality of the papers, but we have included it as a interest from the researchers, and we did the quality appraisal. But again, I repeat that is not the mandate for the scoping review. We then developed our objective to analyze the demographic trends or map the emerging themes or assess whatever is the methodological shifts, whether there is a change in methodology. Means previously people used to do a lot of quantitative research in medical education, whether there is a shift to mixed method or qualitative, and to inform the future research. And actually, because of these areas to be explored, we could have just done the mapping and found out which areas to be done, but we went a little ahead and had quality. There is an article by Davis et al. And they have done scoping review on the scoping reviews, which are published in the nursing literature. So see how simple they have kept to evaluate the status of scoping studies undertaken within the field of nursing. And they exactly for the what is required for the scoping study are the extent, range, nature of the scoping studies, processes used to undertake scoping, or they have also identified the quality, utility, and position of scoping within the hierarchy of research evidence. Uh, there is one more article which this presentation will be shared. So you can go through that. The right questions and scoping studies in commissioning the research on organization and delivery of health services. So there are many studies, scoping studies. You will find that whatever is the reasons given and which should be there in that research question and the whatever inclusion criteria you are putting in. The types of evidences which, as I mentioned, they are always heterogeneous. Original research studies, systematic reviews, meta-analysis, abstract, uh, qualitative study, narrative reviews, they are taken. But in addition to that, what is not in the, it may or may not be in the public domain, but not by the commercial print houses. They are under the control of commercial print houses. This is termed as gray literature. And you may get the guidelines, you may get the conference proceedings, which are not in the public domain from an institution, or if you are having the conferences for over a period, you can get the proceeding. Policy papers, thesis of the students, or websites, blogs, all this is called as gray literature. And you can include that in the study, but it has to be mentioned in the protocol when you are putting the protocol, that what you are going to include. Uh, Also in the protocol, one of the most important part of the methodology is the search strategy. As we are putting the inclusion criteria, that is the eligibility criteria, that has to be determined first uh, before you decide what will be your search strategy. And I've discussed already what can be in that. It depends on PCC. But one more important thing is the language selection. Now, when we are doing study on this MER in India, we said that we will have only the English language article. But there was a pertinent question from the reviewers for now, that why you are taking only English language. There may be some studies which will be there in the vernacular language, and you know that India has got so many vernacular languages, and there are scientific magazines in vernacular language. So why you are not going through that? So we have to do the literature search and found out, and luckily we got the reference from the government, and somewhere in the someone has posted earlier that there are very less percentage of studies, scientific studies, which are reported in the vernacular language, and then we put our defense that way. I don't know whether it is acceptable or not, but this is pertaining to India. Now think about the global picture. You have to mention about the language. Are you going to take the literature in English, or whether you are going to go for the other languages? There may be studies published in Spanish, there may be studies published in Chinese, Japanese, and whether you are going to consider that. And today, people can say you translate them. There are translators available. So why you are not selecting it? So you have to decide what you are going to do as a researcher and explain that rationale has to be there. But literature search has to be comprehensive. You can't do means in case of traditional review, you can select some of the studies doing Google search and all and write your review, but that can't be done. you have to mention in that search strategy which databases you are going to use, what will be your search platform for that, what search dates, because you must be knowing that when we are doing the PubMed search, when the article appears earlier, you may not, or in the Google Scholar mainly, that may that will come in the first 10. You can't go for the 1,000 pages of that. You can say I will see only 20 pages, 10 pages. So some articles which are published recently, they may not come early. But as the time goes, those articles start getting, as they are read more and more, they start coming in the first 10. So if you are searching, you have to define that I'm going to search from this period to this period. In 21, if we are doing that, we are giving 6 months for the search. If you mention that, if I do the search again in 2025, I may see that the entire list is different, because even for the articles which are published from 2016 to 2021, forget the articles which have come later on. I'm not looking at that, but that articles in 2016 to 2021, the articles getting published in 2021, more articles you will find later on. And therefore, the writing the search date is very, very important. So don't rush for the search. Keep all these things in mind. And the keywords, what we are using the search for the search, and the Boolean operators, the search terms you are using. What institutional websites you are looking into, and whether you are going to do the hand search articles, and sometimes you do it because you find that articles may not be those journals may not be available, or those journals are coming in your library, and you want to sit, and you feel that journal is very, very important. It will publish more articles related to the topic you have chosen. So you have to mention that also, and the source material. And this is an iterative process. So during you may be doing the search strategy and doing the extracting it for the full review, but you may have to go again, because you may find in the protocol you mention one database perhaps, and later on you feel that you should add more databases which is available to you. So you can change over there and amend your protocol. So that is also possible. So again and again you may have to do the searches to be very sure. When you are doing, once the search is done and you get those lots of articles in that, then you have to select the articles from that. Now reading all the articles becomes a Herculean task. So you have to see, initially just go through the titles and the abstract. Your inclusion criteria should be in front of you, and review them, and then select the articles from that. The titles and abstract you feel that it is fitting, it should be taken. And those articles can be taken as a full text retrieval. And then further, you can review against the inclusion criteria. It is necessary to have at least 2 reviewers. If it is more, it is good enough. But you have to then distribute the work appropriately. And you have to also mention in the protocol how you are going to manage the disagreement. The two people may not agree with each other. I feel that it should be taken, and some of that other person may feel that it should not be taken. So you have to mention it, whether you are going to do it through discussion and reaching some consensus on that, or you will be having a third review. So at least in your team, 3 people should be there. Again, it depends on the research question and where you want to go. Whether you are going to have that global scenario, then you may require more people. You have to pilot test. Once you develop that search strategy and you are doing that article, don't discard initially, do everything, and then the 2 people are discussing. Do 5, 10 article searching, only abstract and the title, and then you can have a meet and discuss and see how much is the agreement, whether there is a lot of problem coming, or both of you are going in association with each other and they are agreeing. So pilot testing is important. And it is also important when you are deleting the article, you can't forget it, because you have to ultimately in the manuscript, you have to mention which articles have been deleted. Not only that, the reasons have to be mentioned. So there has to be an appendix attached to which is a supplementary appendix attached to your manuscript, which will give you the deleted article. So you have to make a list of deleted articles also. And we took a lot of time over there, because we had kept the initial this thing, we selected the article, but again we had to go through the deleted article. We had not written the reasons, so we had to write the reasons right from the beginning. And in the results you can then narrate and how you have done this search, how you have done the screening, and there is a flow diagram you can give. Like this is also as per the Prisma SCR guidelines. So they will say how you have identified the articles, from which databases you have taken, and how many articles you have selected from that, and which how many articles were handpicked. And then how in the screening, how many articles have you found that there were duplication and you have removed it. And then how many remaining articles which were screened. And then how you tested the eligibility, that is that full article study where you extracted the data from that particular article to study there. You are going to study that. So after reading that article, how many articles you find that they were not meeting the criteria. So we had some data that we got, even if we had that cap of 2016 and 2021, some articles creep in, like which were outside the stipulated form, or some studies were not related to the medical education, though from the abstract we could not make it out. Or some articles we found that we selected it, but they were not original research article, which was one of our inclusion criteria. They were opinion articles or the review. So you have to mention, and you can see out of 348, we had around 110 articles we deleted. So we have to make an exhaustive list of those articles, looking at them. And then which studies you have taken for the analysis, which you are going to extract the data from. So these articles, when you are using it, you have to develop a table for the data extraction, because these are your evidence sources, whatever the articles you have taken. So you have to, that whatever the key information you want to record from that, there has to be a table which has to be prepared with appropriate heading. So it could be citation, author, institutional detail, country, methods, design, whatever the findings, conclusion, well, who are the participants, type of intervention. If you are looking for the barriers and facilitators, that also, outcome also, it depends on what you want. And JBI also offers a standardized data extraction form that can be utilized by the author, so that there is a minimum potential. So you can look at it, you can use that form, but depending on the research question, you can change that and you add it. And like search strategy, you also do the pilot testing, and it can be refined. And again, at least 2 reviewers and iterative process. So this is a data extraction form, which is from one of the articles published in JBI. So on one side, you can see the variables which they have taken, and on the other side, whatever is the data they have got from it. Then the data analysis has to be pre-specified and it has to be refined later. There should be descriptive statistics which has to be given, and basic quality. And even if it is a qualitative data, you don't have to go to thematic analysis, but basic coding and categories one can do. And it has to be put as a tables, graphs, visual chart. And please remember what I mentioned, then it should be user friendly. So every time in the manuscript when you are writing and in the protocol, you have to give the rationale why you have selected this strategy, why this evidence, why data extraction, why this type of analysis. And when you are putting it in the results, you can, in the results usually you write those about the search strategy which you have given, and how that is helped in the selection process. How many means in that flow diagram. Search strategy means you describe the search strategy in the method, but in the result you will give the flow diagram, and then key information or the results which is relevant to the research question. And in discussion, you summarize those main things. You show their alignment with the objectives and review question, and discuss the relevance as related to the current literature practice and limitations and conclusion. Now, like the diagram, Miss, you need not give every time the percentages. We converted. These are you can see there is a list of states in India, and there are red lines which show the percentage of publication we got from that particular state, because we have already extracted the data for the state, and the percentage of medical colleges. Now, this percentage of medical colleges, this we did afterwards. We didn't mention it in the protocol, but later on, when we got it and we thought that we can represent it, we found out from the government site, we found out how many states are there and percentage of the states compared to the entire Indian medical education colleges. And we prepare this data. But it can be, here lies your creativity. And I'm sorry to say we were not that creative, but you can put it as a map. And you can put that instead of numbers, you can show it by the dots. And the size of the dot can indicate. So one can easily find out what is happening. The next thing for the reporting, actually we have got a very good tool, that is this Prisma SCR, and Prisma stands for Prefer Reporting Items for Systematic Reviews, extension for the scoping review. So it is such a good document. It will give you the entire checklist, and it has got the appendix. And if you look at the left-hand side, that blue thing, that appendix of this, there is an explanation and there is a elaboration. So for title and abstract, they have given a title, identify the report as a scoping review. And then the example is given, screening of cognitive impairment in the dialysis population or scoping review. So you know from the title that there is a dialysis population, P is there. You know that there is a cognitive impairment screen, that is your concept. And you can see the context will be now in the it's the dialysis, where the dialysis is going, and they have given the explanation and elaboration, and this is happening for each and every part of this Prisma SCR. So right from the abstract, introduction, method, each and every point is given, and its explanation is given, plus it is the examples are given in the appendix. So it is a very beautiful document, and one should read it when you are writing the protocol and writing the manuscript. Now, one has to remember while concluding this that we are not always doing the methodological quality, or we are not seeing that critical appraisal, so the risk of bias of that evidence which we have included. And therefore, you can make the specific implication for the future research based on the gaps of the knowledge, as I mentioned earlier, but not the research gaps, because you don't know what are the research gaps are there. You have not done the critical appraisal. Similarly, for the, if you want to implication in the practice, they will not be as good as for the systematic review, because systematic review will give you the concrete guidance. This will not give you the concrete guidance, but it will tell you the direction for the clinical point of view, or the for the policy making. We in our project, because we had a review question and we have mentioned and overall quality, we did the quality analysis of the projects using the MMAT appraisal tool, and then we found out the gaps and we have given the recommendation. But again, I'm repeating, this is extra work. Whether to do these automation tools are available, there are several reliable and validated automation tools are available for almost each and every protocol step of the protocol. You can have the automated tool, but they are not all are free, and they are proprietary, and they may not be affordable to us. We have not used for the earlier one, but now we have used Ryan for initial title and abstract screening phase. So I have got a very limited exposure to it, but certain registration of the protocol we register in the open science framework. Similarly, for extraction, data charting, Google Charts are free or Google Data Studio. Prisma flowchart preparation, one can do it. It's not very difficult. And for report writing also. So JBI itself has a software, and that is JBI Sumari. And that is a good software. We can use it number of times. We have to give, along with the manuscript, supplementary appendices, and these include the list of search term and the full search strategy you have to give. You have to give the plasma SCR step checklist is there. So that may not be published, or it may be published, but it goes to the reviewer to see that whether you have completed that checklist or something is missing. I already told you about the deleted articles and data extraction instrument, which you are preparing for your data extraction chart, that has to be submitted. They said to submit the source of evidence with variables charting, and that's why we have done everything in the Excel sheet. Initially, we did on the Word format, but then we put the data in the Excel sheet because it was easier to do the analysis. And that we have submitted the entire Excel sheet. What are the challenges that can be encountered? First of all, determining whether the scoping review is appropriate. So now, one has to see, I've already discussed it, but one has to give a thought what we want to do and how broad we want to go, or whether it is a very specific thing like effectiveness, meaningfulness, appropriateness we want to study. So this thing can change. There is a search strategy may be inadequate because if you don't have the access to the databases, the management of extracted data, there may be too many data. And that you must have seen a term deduplication. That means removal of the duplicate articles. When you are doing it, depending on the search terms, you may get the same articles in that. So unless you are using some reference management software like Zotero or Mendeley, those duplicate articles may appear. And we have seen it because you don't remember also that when we analyze 248 articles, it is impossible to remember. And that articles, even if we were 4 people, so three of us, we did it in pair every time, and the third person remained as the. But the number of articles, I did 40, someone did 40 with someone, then again it changed. So during that rotation, I may have done it, but I will not come to know that there is a duplicate article there which others has seen. And we came to know that when we prepare the Excel sheet. So to change everything becomes, and to confirm it also becomes a difficult thing. Result preparation, as I told you that we were not so creative maybe, but you require a creative mindset. And if you go through the literature, you will find the way the data is presented. It is not just the tables or bar diagram and all. You can do it in such a way that it will be easily understood by the readers. Regarding those automated tools, there is one more problem. These tools may not be compatible with each other. And you do get it from one, and if you want to do for the extension, other thing is you want to use it, it is not possible. And I already mentioned you that subscription is needed for them. And you should not overstretch the conclusions. Like I told you, there is a limitation to the implication which are arising from the scoping review related to the research and related to the practice. And main thing is the lack of training. We are not trained in doing the scoping review. So we did with the trial and error method, so the researchers are not aware. Even sometimes the reviewers and editors are not aware of this type of reviews, and it becomes difficult for them to give the suggestion or the question. From the questions which are asked, we can understand. It means we now got the questions from the experts, and the quality of the questions we are facing now and what we have faced earlier while publication was different. And there are misconceptions about the scoping review. You remember in that early definition in 2001, there is this thing that it is rapidly, to be done rapidly. So people say it is a really rapid, it is easy to do. We don't have to invest a lot of time and effort. Making that narrow question, focus question is difficult. We have to have the broad way of question, but they are not true. You require a lot of time for scoping reviews as well. Compared to systematic, it may be easier, but not otherwise. So the tips I would like to give you, first you have to have your team. So you have to have enough number, assign them roles and responsibility, and if possible, better to have a well-trained librarian or the personnel with information science background. It's usually the librarians have this information science this background. So they will help you in the search, and they can means make your strategy more concrete. And you have to have the regular team meetings, because there are a lot of things you would like to discuss. You find the articles are simple, but while doing it, while extracting the data, there could be lot of things come to your mind, and you have to discuss it with someone and come to the consensus. It is always better if you have a mentor, which we didn't have in the early stages of our first article. But now we have someone with us who have done lots of scoping reviews, and therefore the guidance we get is very, very important. And remember that there are indications for the scoping review. So don't do the scoping review when you require that synthesize or very critically appraise answer to a particular question. You keep the aim as overview or mapping, then it is all. And there are now so many articles have appeared, and each article is good for each step of methodology, right from the protocol writing to the reporting, and use those key articles for the guidance. Some of the things are repetitive, but you get a different angle from individual article. And this plasma SCR manuscript writing also, you can means you have to use it for, you not can, you have to use it for reporting. So that is all I wanted to share with you, and I would like to know if there are any questions, or I request the seniors to add to what I have said. And I have got a list of references also with them. So references are right from the scoping review definitions to whether scoping review or systematic review, to different stages of the scoping reviews. For each, there is a reference. The most updated one is by the Aromataris, which is available at the JBI evidence synthesis site. And there are others also which are important for the knowing the challenges or whatever is emerging from the scoping review. And I mentioned about this that whether this you should do the scoping review or whether you should do systematic review. There is one tool available at internet, that knowledge translation program, which came up in 2020. So you can put your question and see the response to that. Thank you.
Hi, Nirmala. There is a question by Tara. Tara, do you want to answer ask the question, please? Okay, I can, it's in the chat. It says in meta-analysis, dependent effect sizes from the same study can bias the results. How do scoping reviews differ in handling such dependence? Also, what is your guidance?
I will repeat again that scoping reviews don't go into this analysis. There is no analysis, statistical analysis done when you are doing the scoping review. So that's why the bias will remain, and that's why they don't look into the quality. And that is why the conclusion you get after doing the scoping review will not be as though for the systematic review. So right in the beginning, depending on your question, you have to decide. You are just doing the overview, or you are mapping that whatever the evidences are there and what type of evidence. You are not doing the looking at the quality of the evidence by critical appraisal. That is not the purpose. And that doesn't mean the scoping review are inferior to systematic review. You are asking different questions. So you naturally will get different answer.
Perfect. Any other questions? No. I was just thinking, listening to you, Nima, how is this AI going to affect such reviews?
I will help. Sure. AI will help.
Everything I see these days, I have AI in mind. And because the next educators, whether they're medical educators or any other, they are learning from AI.
Yeah. The only
So,
thing that we don't know the AI, once you get that extracted data, and you can use AI maybe perhaps making those visual things, but to analyze that whatever you are getting, and that is all descriptive data. So from the descriptive data, you are making a judgment. And whether the AI will be able to do that or not, I'm not very sure, because the AI should be trained. But maybe in a longer run, the AI will get trained and will be able to do help. But those whatever the tool softwares are there and apps are there, they are helping the researchers in means many steps. They are making it easy. That when we did the abstract and title screening for the first project, we took lot of time. But when we used the Ryan, then that work got over in 15, 20 days time. So it makes a lot of difference.
yeah.
Then,
Mukta, do you have a question?
no, there is one question that what about including the non-peer reviewed articles in each type of review? No, the non-peer reviewed articles are not used in this meta-analysis or systematic review. They are always peer reviewed, so that inclusion criteria are very, very stringent. But in the scoping review, you can use it because it is a type of evidence, and you are just finding out what are the different evidences which are existing, how many of them they are as a published and peer reviewed, and how many are non-peer reviewed, and is there any difference between the two, or considering that areas of research which are there, or the knowledge gaps what you are finding. Again, you are not doing the quality of those non-peer review versus peer review.
Right.
So
Muktada, do you have a question?
means looking from above, what is the scope, what is the breadth of the evidence, rather than going too much in the depth.
Muktada, can you unmute yourself and ask your question?
Hi, I wish you are doing well, and thank you for that amazing presentation. We really appreciate your effort. So my question is, we are doing on a systematic review research. So before we start, I think we have to do an initial screening for the research that related to our topic, so we can go with it and do the systematic review research. So my question is, during the initial title screening, should we exclude the study immediately if they don't match specific criteria, like the country or location, as if it's present in our inclusion and exclusion criteria, or should we keep them for the full text review? So at this point, that's stop us.
No, you can do the screening text or abstract, and then you can You can have your inclusion criteria before, and you can select the articles from that. Because initial articles too many, and the inclusion criteria for the system.
जैसा डिमांड बढ़ता है बढ़ा देते हैं.
Sakina,
I'm
can you
sorry.
put that in
I,
on mute? Yes.
I don't hear you well. So can you repeat what are you saying, please?
Yeah, can you repeat it again? I didn't get you.
Yes, can you repeat your answer, please?
What I answered is that you can do the screening yourself of looking at the title and reading the abstract, or you can use these softwares like Ryan and do the screening initially. You don't have to read each and every article in the beginning, and then whatever is come, but it has to be done by two people at least, so that you may feel that it should be included. The other may not feel that way. If you are not coming to the consensus, keep that for the full review. Then you are safe. That after full review, you again can decide what is to be done. But whatever after the screening, whatever the remaining articles are there, that you do the full review. Because it is impossible. You may be getting lots and lots of articles, and it is impossible then to look into each and every article of that.
Thank you. So just add something to my question. As an example, if our criteria is strictly concentrate on a specific country, and there is a research near the same title of our research, but is in a different undeveloped country, another country that we need in our research. So is that okay to save this research as a CSV for the future to be involved for discussion?
Yeah, you can. It depends again the context you will put in the research question. So if someone has done the research another country, you can do similar one for your country. There is no harm. We did now only for the.
सब छुट्टी थी, मैंने बोला चले जाते हैं, गर्मी है जो देखा जाए, और कभी जब भीड़ नहीं होती तभी आना अच्छा होता है.
Excuse me, please click on mute.
Yeah.
But you can repeat it and see the reproducibility. I mean, see what happens in your country. Maybe when that comes as an evidence, in future someone can see what is the difference between the two countries and whether that is also one of the factors which is affecting the outcome. That can be done.
So it could be a beneficial as a part of like a recommendation in the end of the research or in the discussion. You mean that for comparison between two things?
In the this thing reviews.
Thank you for your answer.
Yogesh, do you have a question?
Someone has written how many references must include in scoping and meta-analysis, at least which years starting till updated. It's not like that. That how many are there? You have to decide your timeline. If you want to say in the last 5 years, or whether you would like to say that whatever is there so far, I would like to include all. Like in systematic review, you must have seen that we get the review articles. Sometimes I've seen that even people have used uh, seven references lesser than that. So people can do it, though ideally I feel it should not be less than 10 or something, but there is no guideline for that. You should have so many number of articles. And which year starting till updated also is not needed. It depends on your research question. We have taken 16 to 15 because we started this thing in 2022, and therefore we wanted that articles during that 5-year period. But we published quite late. It took us a lot of time for that, which ideally, again, that is an abnormal time. One should not get it for a scoping review.
Any other question?
Thank you for this presentation. I have a simple question. I know the difference between literature review and systematic review. In terms of scoping review, what is the main difference between them and the literature? Thank you.
Okay. I have shown, I don't know whether you were there that time. I will just go back and show you the slide maybe. That is, see, when the literature reviews are what we traditionally write, we don't have a research question. There is nothing, there is no protocol, no registration, there is no systematic strategy. So whatever the search is done by the author, it's not that transparent. Whatever the person writes based on his or her experience and expertise, that he doesn't do the quality of the means appraisal also of those articles. He may say in the review that these articles, there were less number of participants and that's why very poorly written or something comments he can put it. But it is a individual, no, from his individual judgment. As against that, about the systematic review that they're focused and they have all these parameters are yes for them, whatever is there on the left-hand side. When the scoping reviews come, the research question itself is different from the systematic review. They are very broad based. And when you want to find out what is the effectiveness of your intervention, what is the appropriateness, whether there is feasibility, all these are for the systematic review. But if you want to see what is the evidence available for that particular intervention, what are the characteristics of the people who have entered or undergone that particular intervention if it is not selected, or what is the outcome after that broad outcome that like our HP, it is a learning performance. All these broad things as a mapping or overview can come under the scoping review. But you will have to have the protocol. You don't register in Prospero. It will not take, it takes only systematic review, but there are other frameworks, means others, the open science framework or Figshare, and there are a few more. I have put it in the automated tools. You can register over there. And that whole process is very exhaustive. It is very explicit. And suppose someone wants to reproduce or check the reliability, it is open in front of them. That is what we achieve by both scoping review and systematic review. But the research question makes the difference. And second difference which is made by what evidences you are looking for. In case of systematic review, you will go for the original research article while doing the systematic review and then the meta-analysis. And it is backed by very sound statistical methods. You must be knowing those forest plot and all those things. But in case of scoping review, it is not so. You can take the peer-reviewed articles, you can take the grey literature. You have to give the justification why you are going for that particular literature. Ultimately, you are trying to find out what type of evidence is there, if there is a gap in the knowledge. So when doing that, you want to see whatever is available in the domain. You will pick up that. You will try to pick up that at least and analyze it, and you will give your judgment. So based on that judgment, perhaps someone will feel ki, okay, now this person has found so many articles on say particular intervention, and now, so it is feasible to do the systematic review, and that someone will do the systematic review or you will do it later on. But it gives you just the map. It tells you what is going on in that particular field and what type of evidence is available. That's all. Nothing more than that. That is the main difference. And you don't do the quality, means that the appraisal of critical appraisal of the article. So the quality is not taken into consideration. You try to take it as much as possible, the evidence is possible, and whether you can make some judgment based on that.
Thank you so much for your explanation.
Thank you.
Any other questions while we still have her? Okay, I'll take the silence as no. Thank you everyone for joining this morning or this evening. Thank you, Nirmala. Appreciate your sharing your knowledge and experience. Really appreciate it. If no one has any questions, we will end our webinar today, and we will see you in 2 weeks.
Thank you, Sakina.
Thank you. I will post the recording as soon as it's ready, and please don't forget to add your name for the certificate. Okay. Thank you.
Thank you.
Bye.